Okay, so one of the seriously saddest things about being a startup practice owner is every time I hire a staff member and they've come from a DSO environment, they are traumatized. I feel like I'm part dental practice owner and part rehabilitation for these broken team members because these DSOs treat team members so sad. And it is really what tips the scale for me from being like, whatever, DSOs, there's a time and place for them, whatever. They are harming dental professionals. And it's not just the assistants, it's not just the business team, it's not just hygienists, it's the doctors too. Everybody gets into this mindset of like production goals and nothing else matters. They're skipping lunch breaks. They're not getting time for water. They are doing treatment on patients that they know is not ethical. They are speeding through appointments because they just have to get the numbers up. But I've heard so many horror stories, and I know you know what I'm talking about. Extractions that happen on patients who maybe shouldn't be having them in a general practice because of the medications they're taking or their clinical history. It's really hard to watch staff come onto my team and they're literally like wounded birds, and through time, because takes time to build trust, they start to realize that we're a private practice that just really wants to treat patients well. We want to treat the team well, and there's no hidden ulterior motive. And so that's really my goal, is I want to share how to open your own startup because it's so important. It's just not right. So anyway, that is one of the saddest things of being a practice owner, is every time I need to hire a team member, I know that there's a period of time, those first 3 to 6 months, where unless they're like brand new to the industry or they've worked for an amazing doctor before, we're going to be dealing with somebody who is wounded and traumatized and is wondering, will this doctor throw an instrument at me, or what am I going to have to do, or what kind of upselling or what kind of lunch and learns are we going to have that's going to tell me how to make the practice more money, or our morning huddles are just going to be all about like how much more money we need to make that day and how we're not hitting our goals. We do none of that. Our philosophy is if we take care of our team and our patients, then everything will work itself out. And so I want you to go open a practice because I know that you'll run a practice ethically, treat your team well, and we can start turning this industry around. It's literally so sad. Anyway, can't tell you how many team members have cried in my office, thanking me for running the practice that I do. And I'm so grateful and happy that we can do it, but I'm so sad because we feel like such a small little light in the world. It's so sad that this is not how the dental industry is going, and it's getting worse by the week. Go open your private practice. I have a 90-minute course that tells you exactly what you need to do if you're unsure, but whether you do my course, whether you do anything else, go start opening your own practice. We need you.